Hello, I'm Dr. Brian Abelson from Kinetic Health. Today I'm going to go over a really good stretch for the peroneal muscles. Two of those muscles, peroneus longus, peroneus brevis, otherwise called the fibularis. They can change the name of the muscle halfway along in anatomy. But these are muscles that actually run down the side of the leg here, kind of loop around and attach to the bottom of the foot. Really important muscles in terms of stability. These muscles are commonly damaged when we have a sprained ankle and inversion sprain, but they're also really important in terms of just keeping in a neutral position. If these are damaged, we're going to end up having abnormal motions of pronation, supination. So one of the ways we're going to stretch this out is to sit down, cross the leg over as Leanne is right now, and then we're going to take the foot and we're going to put it into plantar flexion. This is dorsiflexion, plantar flexion, or just having your foot pointed. And then I get Leanne to actually reach underneath the bottom of the foot here. Good. And then we're going to basically invert it more. So we're going to basically take it and torque it over like this quite a bit. Okay. Making sure that we keep the foot in a pointed position. And we should feel the stretch all the way up the side of the leg. Are you feeling that?
Yeah, I feel it all the way in.
Yeah, and you've got to put a fair amount of tension there to actually get the stretch too. Now, bring your foot back up here and try and turn it to the side a little bit. Do you feel any kind of stretch?
Not so much.
Not so much.
No.
Point it down, all the way, do it again.
Okay.
Okay, take it right over. Can you feel that stretch now?
Yeah, it's deeper.
Okay, excellent. Really good stretch for the peroneal muscles. Okay, now we're going to go over a second stretch for the peroneal muscles. This is a great stretch for actually getting even farther down the leg. It's extremely effective. To do this stretch, you're going to need either a stretching cord or a towel. Lie on your back, take the top leg and have it bent in. Now, I'm going to have you straighten the leg out a bit here. Good. And then we're going to move the foot from what we refer to as an everted position into an inverted position. Okay, just one sec here. Go ahead, Leanne, just take it over that inverted position again. Now, pull it up just a little bit farther and then tighten the cords a bit. You feel the stretch down the side?
Yeah, all the way down.
All the way down, right by the fibular head there, right down by the knee?
Yeah.
Excellent. Really good exercise. Now, when you're doing this, make sure you stretch it for maybe 10-15 seconds, but I'd like you to repeat this several times, so 3 or 4 times. Stretch it for 15 seconds, bring the leg back down, then back up again. Really good exercise. The next component we're going to show is the myofascial release of the peroneal muscles. Now, what I've found works really well is to use a travel roller. It's a smaller roller than the large foam roller, which you can use to do this, but this is one of the most effective ways that we have found. So what we do is Leanne will get in this position where we're crossing one leg back, and then we're going to bring the other leg forward and rest the side of the muscle on top of the travel roller. Okay, go ahead and just kind of roll back and forth on there. Good. This can be fairly intense, but sometimes it'll be difficult to actually get into the tissue if you do not get in this position. You feel like you can get in there pretty good?
Oh, really?
And actually control the amount of force you're putting on top of there? Okay, so you go back and forth for maybe about 30 seconds. If you find any particular area that's really tight and restricted, you stay on that and then just go back and forth for about another 10 to 15 seconds. This is a really good way to release the peroneal muscles.